thank you for everyone who's come today to defend our NHS and for all the powerful speeches that you've made. I think people often think of the NHS as this thing that will just always be there. It's just a fact of life, it can't be eroded. But of course it's not so long ago, and in fact in some people's living memories, that the NHS didn't exist at all. And if you were sick and you were poor and you couldn't afford healthcare, people simply died. And if the Conservatives had their way, it wouldn't exist. It wouldn't have ever existed. They voted against it 22 times. In government over the last 14 years, they've done everything in their power to erode it. They presided over underfunding, backdoor privatisation, staff shortages, and people just not being able to access the care that they need when they need it. So I'm glad that our new Labour government has made record investment in the NHS, but we must protect our NHS from corporate interests, crack down from the corporations profiting from people's ill health, and make sure that everyone can get the healthcare that they need without having to pay for it. I really wanted to make 2 points today. First, we cannot fix our NHS without fixing our broken social care system. Yeah. We have people who are medically fit in hospital, unable to be discharged because there are no suitable social care placements for them to go to. We've got private providers who are rinsing our social care system, and I've seen firsthand, as someone who used to be a care worker before I was an MP, just how profit poisons the system, how it makes people's care worse. It's bad for the people receiving care, it's bad for people working in care. Instead, we need a publicly owned, publicly funded, publicly accountable national care service that is free at the point of use, that is co-designed by people who know it best, and that's people receiving care and people providing it, and of course local communities as well. We need good pay and conditions, and I'm proud to support my union's call, the GMB, and also Unison's call for care workers to be paid at least £15 an hour, because we know that working conditions are also the conditions in which people are receiving care. Disabled people and older people deserve choice, control, autonomy and dignity in their lives, and the support that they need to be able to live fulfilling and independent lives. And at the moment our society is monumentally failing them. So just as Clement Attlee's Labour government built our NHS from the rubbles of war, our Labour government today has a once-in-a-generation opportunity and a once-in-a-generation responsibility to build a national care service. The second point that I wanted to make was that we cannot fix our NHS without fixing inequality. Inequality is making our nation sick. We've had over 300,000 deaths, excess deaths, between 2012 and 2019, linked to austerity. 1 million children in this country are destitute, not just living in poverty, but in destitution. And we've seen damp, cold and mouldy homes quite literally killing people. So improving public services, building council homes, giving tenants proper rights, boosting wages, improving workers' rights, investing in, not cutting, welfare, and giving people a real stake in their life. This is how we defeat division. This is how we build a healthier society. And I'm pleased to say that in some of these areas the government is making some really positive steps, but I fear that in other areas we're going in the wrong direction. And where we are making good steps, there's no doubt that the government needs to go further. And that is why movements like this are so critical. It's so important that you keep coming out, marching, making your voices heard. So thank you, and I look forward to continuing to do that together. Solidarity everyone.